to join our call today. I'd like to go ahead and try opening up the lines and having us be able to introduce ourselves since we have about 8 people on the call so far. And I know that some of you comprise groups of people. So what I'm going to do is when I open up the lines, if I do hear background noise that makes it difficult for us to be able to hear people, I will go ahead and try muting people so that we can hear each other effectively. When we begin the webinar, I will mute everybody, and then I will open up the lines periodically for questions. And additionally, I'll take us through a process of understanding how we can raise our hands using the webinar technology so that if there are questions along the way, we can get those answered as well. So I'm going to go ahead and open up the lines, and we'll see how effective our listening capacity is with background noise and such. When I do so, I'd like to ask that if you're with a group of people, that you be prepared to tell us, choose a spokesperson who can introduce who the group is, and just let us know how many people are joining us today from your group.
Yeah, we can do.
Hi, this is Ken Baird.
Oh, good.
This is Betty Jo Dickey.
Hi, this is Ken Baird. I'm with the
Okay, so we're hearing some background noise. Let's wait a second, and I'll go ahead and I'll invite people to introduce themselves. I'll call on you by first name. So can we have Anthony introduce himself, if Anthony would like to? Okay, and can we have Betty introduce herself and what county she's from?
This is Betty Dickey, and I'm from Fresno County Mental Health.
Great. And Betty, are you joining us alone today, or are you with other people?
I'm joining you alone.
Okay. Christopher, would you like to introduce yourself? Okay, and we'll come back to Christopher. Debbie, would you like to introduce yourself? Debbie Pasco? Okay, and I know Debbie's down in San Bernardino, and she may be facilitating mental health board members down there discussing this. And Danette? Okay. How about Kathy? Would Kathy like to introduce herself? Kathy Day?
Sure. This is Kathy Day, and I'm with Sacramento County. I'm joining you guys alone.
Okay. Thanks, Kathy. Welcome.
Thank you.
And Ken, would you like to introduce yourself?
Hi, yes, I'm Ken Baird. I'm with the Kings County Mental Health Advisory Board, and I'm alone.
Okay. And then we have Molly Stevenson.
Hi, I'm Molly Stevenson. I'm with the Napa County Mental Health Board, and I am here alone.
Okay. Welcome, Molly. And Susie Gulshan. Okay. And Bob Heber. Okay. Let's try, I see Danette Hughes is muted. I'm trying to unmute her. Danette, are you able to talk with us right now and introduce yourself?
Hi, can you hear me?
Yes, I can.
My name is Danette Hughes, and I'm on the advisory board for Kings County Behavioral Health in Hanford, California.
Great. And are you joining us alone today, or are you with other people?
Alone.
Okay. Thanks,
Thank
Danette,
you.
and welcome.
Thank you.
And let's hear from Jeremy Breeze. Introduce himself.
Did you hear us? Hello?
I can hear Jeremy barely.
Okay, can you hear us now?
Yes, we can hear you now, Jeremy. Yes, we can hear you now, Jeremy.
Okay, we're here with 4 other local board members.
Okay, well, welcome to Jeremy and Bethel. Jeremy, I'm going to go ahead and mute you now because we're having some feedback from the line. Okay, and Judith, would you like to introduce yourself?
Yes, Judith Lewis from Orange County Mental Health Board.
And Judith, are you listening alone today?
Dave,
Yes.
will you transfer the calls? Not to you.
Okay, thank you, Judith. And Rosemary, would you like to introduce yourself?
Oh my God, we have to buy that house, Mom.
Okay, and we're hearing some definite
That'd be
feedback
so
noise, so we'll kind of stuff in
I have to always find something bad to say.
Okay, so let's go ahead and here we go. And let's see, if there's anyone that I've missed, go ahead and raise your hand if you understand how to use those controls. I see April as well. April, would you like to introduce yourself? Okay, and that's April with Sierra County, and hopefully we'll hear from her later. So right now we're going to get started, folks, so that we can be mindful of your time. And if we missed welcoming you in person, know that we do have an attendance list showing everybody that is attending today. So we will be keeping track that you've attended. So no need to worry if for some reason you need to be able to document that you attended today. We do have a listing of that. So again, this is Donna Matthews, and I am with CIMH, and I am the person that works on the project to support your local mental health boards and commissions across the state. So one of the advantages of having these webinars is that we get to bring education to folks across the state all at once. So whereas in the past we've had some regional meetings and that sort of thing, this is an opportunity really for us to be able to provide the information on a statewide basis at the same time. So part of the advantage for you guys, for you all who are attending, is not only knowing that you're getting the same information as every other mental health board relative to this training, but when we open it up for questions and answers, you're going to be able to hear from other boards and commissions that you might not normally interface with. So without further ado, I'd like to go ahead and get started. We're going to begin with a little bit of etiquette on how we use technology for those of you who may need some reminders. And also some instructions on how to ask questions and that sort of thing. So I'm going to go ahead and advance the slide at this point. And based on a request, I've gone ahead and I've added a picture of myself to this presentation because I heard from a number of people that they thought it would be really helpful to be able to visualize who is this person talking to us for a couple of hours. And so I've gone ahead and I've added my picture just so that you can get an idea as to who I am. Okay, so participating in webinars. Again, in order to join the audio portion of the meeting, and we're doing this for the benefit of those people who may be on right now but may not be connected to their audio, and also just as a reminder for the future for how to prompt yourself in joining by audio. So once we've joined the online portion of the meeting and the audio information is provided in that little pane as displayed in the middle of this slide, you're able to then dial in using the phone number that's provided. You put in your access code, and then you enter your PIN. And so that's what you would do if you wanted to join, not by using the microphone and speakers that are part of your computer, but if you wanted to dial in. So for instance, if you have a group of people and you all want to be able to use speakerphone to be able to voice questions and so forth. Also, if we've given you a choice as to how to join the audio portion, as we just mentioned, you can go ahead and make that selection yourself as to what's more comfortable for you. So remember, if you do try to join in using your computer only, you will need to have a microphone available if you want to ask questions, and you will need to have speakers that you can activate in order to listen to the meeting. So participating in webinars, again, what we have done, and you'll see in the box the little visual graphic below on the bottom of this slide, You'll see what it looks like on my panel and on your control panels on each of your webinar screens. What this shows is that if we were John, for instance, we would see that the green symbol there indicates that we have a microphone that's able to be used. In other words, people can hear us if we're speaking. So what I will do is if I hear for some reason when John starts to speak that there's a lot of background noise, I may ask that person to silence the background noise so that we can hear them effectively. Or if they're not asking questions, I have the ability as the presenter to go ahead and mute you. And what that would look like on your screen and on my screen is there will be a little red slash mark through the microphone indicating that that microphone is unable to be used right at that point to be able to, for the person to be able to speak with the audience. So you can mute and unmute yourself at any point by doing that very same thing. Okay, so webinar etiquette is to raise your hand. And I'm going to back up for a quick moment. And I'm going to use my cursor. You'll see my mouse circling the graphic on the bottom of the screen. Whoops, let me back up again. And so as I'm moving my cursor over the microphone column, what you will also see on your screen right now is in a similar column, there will be a column that shows a yellow hand raised. And when you click on that button, that enables you to raise your hand, so to speak, to ask a question. So in this first webinar etiquette, we say raise your hand if you'd like to speak, and the symbol with the yellow hand then gets raised. And I'm going to ask everybody if you're able to, and some of those folks that are listening in groups may not have this function available to them. I'm not sure how you're accessing the functions for the webinar. But I'm going to go ahead and I'm going to actually put everybody's hand down. I see Anthony's hand is raised. I'm going to put everybody's hand down for a moment and just allow us, I'm going to ask you all to go ahead and try raising your hand so that we can see if everybody's able to use that function. So if you will, please go to your control box on the right-hand side of your screen and go ahead and raise your hand if you're able to. Good. I'm seeing lots of folks starting to raise their hands. Okay. So we're seeing Judith and Julia and Ken and Kathy and so forth raising their hands. Okay. Now I'm going to go ahead and lower your hands for you. And now when I next see your hand raised, I'll know that you have a question that you want to ask. I will simply go to your name, I'll unmute you, and I'll enable you to go ahead and ask your question. Okay? All right, so we're going to practice with Greg Swift, whose hand is still up, and Debbie Pasco. We're going to unmute them, and we're going to ask them, did you have a question, Debbie or Greg? Okay, and they're not answering us. So we're going to assume they were still in that practicing raising the hand mode. Okay, and I'm going to focus on Anthony Prito right now. And Anthony, did you have a question before?
Hi there, this is Merced County, and we didn't know that we were Anthony, so I'd like to introduce ourselves. This is Sally Wagner, and I'm with 4 other attendees, so we do have a group. James Fuller.
Can I interrupt you for a quick moment, please?
Sure.
So we're having a lot of feedback on your line, and it may be that you're using a speakerphone. So I don't know if you're able to get a little bit closer to the microphone. That may help with the feedback. Okay, can you go ahead and try introducing yourself again?
Sure. Sally Wagner.
Sally.
James Fuller. Vince Reynolds. Kim Carter. And Cora Gonzalez.
We're hearing quite a bit of feedback. So what I'm thinking is that if you're able to actually pick up the hand receiver, if there comes a time when you want to ask a question, we may have a better ability to hear you. I did hear that you're with James Fuller and there are 5 in your group, and you're calling from Merced County. So we welcome you, and thank you for calling in. So we're going to go ahead on with the webinar etiquette right now. And let's see. Okay, we're going to try to respect and listen with intent to what people say, speaking from a personal perspective. In other words, speaking instead of speaking for other people. And this kind of goes in line with the advice giving. You know, we try to give advice if people ask for it, but to be mindful and just speak from our own personal perspective when we're on webinars. And this will feel a lot like ground rules or a comfort agreement to those of you who are used to doing these types of things. Also, number 4, limited time for speaking when we have open questions, and that's because we have multiple people on this call, and we'd like to be able to enable everybody to have a chance to speak. And agree to disagree, excuse me. And then 6, participants calling in should keep phone on mute when not talking or when they finish asking a question. And so, as I already indicated, I have actually muted all of you so that we don't have some of that background noise we were experiencing before. But I will, once we're finished with this etiquette part and we're moving along, I will keep my control box open so I can see if you're asking questions. And then you can also, at the bottom of your control box, there's a chat ability. It's the very last function on the bottom portion, and you can open up that by clicking on the plus sign. And you can actually send messages to the entire group or to myself as a presenter or to Tiffany Hill, who is supporting us on this call today. So without further ado, I'm going to go ahead and get started. But first, let me just ask a question. I'm looking over on my control panel, and I'm seeing a couple of hands raised. So I'm going to go ahead and open the line for Lynn Fuller first. We're going to see if Lynn had a question. Lynn, did you have a question?
No, it looks on my screen as though the hand, there's a little red arrow pointing down, which I thought meant that the hand was down. So maybe I'm...
Okay, and you have that button on your control panel, and that's a way of lowering your hand if you would like, if it's raised and you would like to lower it.
Got it. Sorry about that.
Not a problem at all. See, what I want to remind you all of is that as we start to use webinars for our trainings, there are many of us who could use refreshers on how to function on webinars, and so all of this is good and all of this is fine, and we will get through our material in the time allotted, so no worries. I'm going to go ahead and open up Debbie Pasco's line and see if she has her hand raised for a reason. Debbie Pasco and the group down in San Bernardino, did we have the hand raised for a reason? Okay. Okay, then I'm going to go ahead and we're going to mute that person. And I'm going to open up Christopher Williams. Christopher Williams, did you have your hand raised?
I don't know if you can hear me now. You couldn't hear me at the check-in.
Okay, my apology. Did you want to just check in and tell us what county you're from?
Yes, I'm from the Calaveras County Mental Health Board.
Wonderful. And are you joining us alone today or with other folks?
Alone.
Okay, well, welcome.
Thank you.
And Anthony Prito, did you have any questions? Okay. Just one, and let me go back to Debbie Pasco's group. Debbie Pasco's group, hand is still raised, so I just want to check in with you one more time. Okay. Okay, so I'm going to go ahead and mute everybody.
Muted.
Okay. So let's begin. So the purpose of this training today is to ensure that we have the understanding of the Mental Health Services Act, and so we'll be briefly going over that, and make sure we understand the impact on our local mental health boards and commissions, to increase the awareness about the roles and responsibilities of local mental health boards and commissions, and also to understand how to develop strategies for increasing our effectiveness on local mental health boards and commissions. So why do local mental health boards and commissions exist? Now let me just preface this by saying I'm going to try not to read to you, so to speak, but part of the benefit of having this PowerPoint is that after we complete our webinar today, I will be sending this PowerPoint to everybody so that you can use it for reference in the future. And so for that reason, there's quite a bit of writing on these slides so that you can then share this information with other people and not have to remember everything verbatim. So again, why do local mental health boards and commissions exist? So in enacting the chapter in the statute, the legislature finds and declares basically that public commissions, and that's any public commission, board, council, for public agencies and entities, exist for the sole purpose to aid in the conduct of what's called the people's business. So it's the intent of the law that actions be taken openly as mental health boards and commissions, and that we deliberate things in an open way as well. So while the Board of Supervisors may be the appointing body for our local mental health boards and commissions, we only exist truly, according to legislative statute, in order to aid in conducting the people's business. And the people's business in this case would be receiving mental health services. So to the extent that we're serving the people in our constituency and in our communities, that's what our primary focus is. So who, again, do local mental health boards and commissions serve? Again, the people of the state don't yield their sovereignty to the agencies which serve them. And I'm using this language specifically because it comes right out of the statute and the legislative authority, so that you understand how it was originally stated, and so that you understand why you can represent yourselves as being spokespersons for your community's needs. But being a spokesperson or an advocate or a mental health board member or commission member never negates the ability of people to speak for themselves or to give away their power to their mental health board and commission. And for many of us, that goes without saying, but for some of us, it's a good reminder. Sometimes we're asked to speak on behalf of other people, and so to the degree that we can make sure to always be speaking for them using their voice or empowering community to come forward, whether it's in our meetings or in other meetings, and speak for themselves, it's a really important aspect of how we empower communities to get their needs met. So the people in delegating authority, again, don't give their public servants the right to decide what's good for them or for people to know. People insist on remaining informed so that they may retain control over the instruments they have created. And instruments in this way means our local mental health boards and commissions. So, and when we see that this is mentioned as the people insist on remaining informed, it means that the intent of our function is to keep them informed. And we do this by having open public meetings, inviting people, inviting presentations, going out and doing community forums, and that sort of thing. Okay, so where do local mental health boards fit in the structure of the mental health structure? And this is from a statewide capacity. So what we see is that, and we're going to go to a next slide that will also reflect kind of the changes that are currently happening in our state. But for right now, let's look at this. My cursor, my mouse is currently circling the State Department of Mental Health, right? And so that's the oversight body that then, and we follow that down to the lower left-hand corner, the State Department of Mental Health has traditionally had oversight and has approved plans, for instance, from our local mental health departments. Likewise, they interact with our local Board of Supervisors. It's our local Board of Supervisors which is actually responsible for taking, for instance, our annual reports to the Mental Health Board or Commission and forwarding those to the State Department of Mental Health so we can be accountable about what's happening in our counties. So then we see that if we're at the local Board of Supervisors in the middle, and we go to the lower right-hand corner, there's our local mental health board. And so our local mental health board, we see, has a two-way communication arrow with our Board of Supervisors, meaning they appoint us and then we're responsive to them, we're accountable to them. But similarly, we see an arrow going between our local mental health board and the local mental health department. Now, what does that mean? That doesn't mean that the local mental health department appoints us necessarily, but it implies that in order to do our business, we need to be in a constant exchange of information with our local mental health department. We're not, we look at our relationship as collaborative, that we have similar goals of meeting the needs in our communities. Now, let's look at our mental health department and its relationship with our local board of supervisors. And our local board of supervisors is the entity that appoints the local mental health director. They do that in consultation with us, and we can give input to that process. But we see from this diagram that both the local mental health department and the local mental health board are ultimately accountable to the board of supervisors. And then our relationship to each other is one of collaboration. Okay? We also have the local, the California Mental Health Planning Council, which is, whose function is to then give oversight to the, whoops, I advanced the slide, sorry, let me back up. The California Planning Council has an oversight capacity to the State Department of Mental Health and is giving recommendations to the State Department of Mental Health about how they oversee statewide programming. Okay, now we're thinking realignment. There's a lot of stuff that's changing. The State Department of Mental Health is being dismantled. And so as of July 1st, there will be no Department of Mental Health for the state of California. What's happening is the State Department of Mental Health and all the programs that currently are overseen by it, including Mental Health Service Act programs, are being funneled to other statewide agencies for oversight. And some of those agencies are the Department of Public Health. Some of them are workforce development state agencies, the Office of Statewide Health Planning, and also the Department of Healthcare Services. So now we're going to go on to the next slide, and we're going to see how this shift in Department of Mental Health going away changes our relationships. So now we see on the left-hand side that instead of the Department of Mental Health now, we see that our counties and most of our services are going to be falling underneath the Department of Healthcare Services. Now this is a pretty sure bet, but anything, as we know in our state at this point, anything can happen between now and July 1st. However, we do expect that most of our services will be not reverting, but rather going to the Department of Healthcare Services for oversight. Okay? Now, for oversight, that just means that that will be the statewide department that is aware of what's being done on a local level. And so we see that now we don't have solid lines between the Department of Healthcare Services and our local mental health department. We don't have a solid line between the Department of Healthcare Services and our local Board of Supervisors. And that's because now with services being overseen on a local level and the state stepping back from needing to approve plans, the state will instead start focusing on what we report our outcomes are. And so we will be able to, on a local level, start to approve plans on our local level only. And so that really puts a lot more power for ultimate approval of plans to the local Board of Supervisors in the middle. And simultaneously, that means that our abilities as local mental health boards and commissions, our role in influencing our Board of Supervisors as their appointees and advising them becomes a little bit more strengthened, because we're not going to need to wait for the local Board of Supervisors to approve a plan and then go to the state and wait for the state. Our level of authority now will reside at the local level. We're not going to change having a collaborative relationship with our local mental health department. That's going to stay the same. And again, be more important and be strengthened by the fact that our decision-making powers are now at a local level. Similarly, our local mental health department will continue, and our director will continue to be appointed by the local Board of Supervisors. Okay, now we're going to move along. So let me pause for a second, go to my control panel, and see if we have any questions right now. Okay, so I'm going to go ahead and look on our attendee list. I'm going to see if anyone has their hand raised. And I'm seeing Christopher Williams. Christopher Williams, your hand is raised. Did you have a question?
I'm sorry, my control screen shows the red arrow down, so I don't know why yours shows it up.
Okay, all right, no worries. Oh, see, your hand just went away. Okay, not a problem.
Sorry.
Thank you, Christopher. And Debbie Pascoe's group, did you have a question at all? Okay. All right, so moving along. So now we're going to talk about the authority, obligation, and relationship of how we get our authority and what our obligation is as local mental health boards and commissions. So this is a statutory authority that's given to us as local mental health boards and commissions, and it's outlined in what's called the Welfare and Institutions Code, section 5604.2. So if you were to go to the State of California legislative site, you would be able to look this up by clicking on the Welfare and Institutions Code and then going to this particular section. The Brown Act is also the law which guarantees the public's right to attend and participate in our meetings. So or for that matter, any meetings of any local legislative bodies. And it governs the actions of the local mental health boards and commissions. And what I'd like to do is, since this is not particularly a training on the Brown Act, is I like to provide this website because I found it to be a very useful, user-friendly website. So again, we will be emailing this entire presentation to whoever registered from your county. So you will have access to this PowerPoint. But for the sake of right now, I'll go ahead and read it out loud. www.thefirsamendment, all one word, .org/Brown Act, all one word, .html. Okay? So the local mental health board and commission, you're probably all aware, but from what we've just discussed, it's a citizen board, right? So, and it's mandated by our state law. Members, as I mentioned before when we were looking at the organizational structure of how we relate to different statewide agencies and to our local Board of Supervisors, members are appointed by the local county governing body, which in this case is the Board of Supervisors. It's advisory to both the Board of Supervisors, that's what the acronym BOS stands for, and to the local mental health director regarding any aspect of the local mental health programs. And I stress it's advisory. So that means we have the ability to advise, and we can advise very aggressively if we decide to, and we can talk more about how we do that kind of advising and advocacy later on in the presentation. But suffice it to say that, again, knowing that we have a collaborative relationship, it's like a three-way collaborative relationship, even though the Board of Supervisors appoints both our local mental health board and commission and the mental health director, we do have a collaborative relationship in practicality. So it makes a lot of sense to think of ourselves as being advisory to anyone who's in the ability to collaborate with us in making sure that our community mental health needs get met. So what do we do? Specifically, local mental health boards and commissions function to oversee them and monitor the local mental health system. Sometimes when we're appointed, we're being asked to represent different constituencies, and yet when we actually think about what our functions are, we actually function, each of our members and collectively as a board or commission, we function to oversee and monitor the entire local mental health system. And so that means advocating for all individuals with serious mental health illness, and frequently we know, especially under the Mental Health Services Act, we know that this now extends, and it's critical to include family members and parents and caregivers and other community collaborators who can support people with serious mental illness. We also provide advice, as we just mentioned, to the Board of Supervisors and the local mental health director, and we ensure that the development of improved services occurs, including access to services and access to the best mental health programs possible. Now, when we say ensure the development, does that mean that as a local mental health board or commission, we're actually going out there and we're pushing up our sleeves and we're developing these services? Probably not. Probably what we're doing is we're serving on a number of different committees as local mental health boards, board members and commission members, and we're participating in the development of those. Or in our advisory capacity, we're advising on what we think might make something more accessible, or how a program might be able to more accurately address the needs of particular communities. So, but in the end, as we look at the last bullet, our function is to review, evaluate, and advise on recommendations we have for the improvement of services. So I'm going to stop again and look at my control box to see if we have any questions. I'm seeing one question, and I'm seeing someone asked, and this might have been a little while ago, so my apology. Do we know where the OAC will fit in the realigned structure? And the OAC is going to be considered as another one of the statewide agencies, and so they will be overseeing a lot of how can I say this? They will be overseeing certain programming which relates a lot to consumer and family members. However, it's not necessarily the Mental Health Service Act mental health programs that are offered through counties. And so it may be some of the statewide initiatives and so forth. What I can do is, and I'm going to make a note of this to myself right now as we're having this webinar, I'm going to go ahead and when I send out information with the PowerPoint, I'll include a cover sheet on what we're projecting to be, how the OAC and how other statewide agencies will have responsibility over different types of programs. Okay? So let me just go ahead and make that notation to myself. Okay, great. And thanks for that question. So that was perfect. Okay, so let's move on. So part one, understanding the Mental Health Services Act and its impact on our local mental health boards and commissions. So the background slide that we see in front of us now basically just reminds us that it was back in November of 2004 that voters passed Prop 63, which is now known as the Mental Health Services Act. And it was designed to expand and transform, really, California's mental health services systems by increasing the practical part was to increase the state income taxes for high-income individuals, people over $1 million. And in that way create a pool of money that would be available to fund transformative programs. So even though our mental health programs in our counties, some may have been functioning quite well and continue to function quite well, this money was dedicated to looking at the innovative stuff that needed to be done in order to further address how to serve underserved communities of people, whether that's ethnic, cultural, racial, rural, so forth, or different socioeconomic and linguistic communities. So again, it was, we all know how that was funded then. It was funded by taxing folks who are making over $1 million. And the Mental Health Services Act addressed 6 different components, and many of us are familiar with these, having been through the past several years of mental health system growth as a result of the Mental Health Services Act being passed. And that we looked at community program planning, we looked at community services and supports, we were looking at capital advancement, so in other words, building buildings so that they could house innovative or new services, looking at how to improve our information technology, looking at issues related to workforce education and training, recognizing that if we have a workforce that is aging out and is retiring or what have you, and even if we weren't seeing a turnover workforce with new programming coming into place, critical to be making sure that our workforce, those people who are providing services or administering and managing services, that they're supported in their education and training so that they're able to do it in a most effective way. And we were also looking at prevention and early intervention, really critical, right? In the medical profession for forever, medical profession's been looking at, at the idea of stopping illness before it happens. And so likewise, mental health systems were beginning to put funding behind looking at those prevention and early intervention initiatives. And then finally, innovation, address those kinds of programs that would actually help us create real change in our system. So introduce a radically different or pilot a somewhat different approach to providing services. Okay, and so the Mental Health Services Act stipulated that the Department of Mental Health contract with mental health departments to do these programs. It required that services, delivery, and support for children, youth, families, adults, older adults with serious mental illness and emotional disturbances, their needs be addressed in specific ways and be evident in the planning. Now, as we just mentioned, with the State Department of Mental Health, in the next month, but by the end of this fiscal year, dissolving, the function of the state is now going to be one of oversight but not approval of plans. But that doesn't change how our mental health services programs need to be responsive to these community needs. And again, just as a reminder, the mental health services funding was allocated to counties in order to, again, address serious mental illness among children, adults, and seniors as a condition preserving priority attention, including prevention and early intervention and medical and supportive care. So, and looking to reduce the long-term adverse impact on individuals, families, and budgets resulting from people who are unable to have their mental health care needs addressed. So again, this is just a little bit more information on mental health services. Again, that Mental Health Service Act programs expanded the kinds of successful and innovative service programs, right? Including looking for ways to make programs and services more culturally and linguistically competent, right? So it's not helpful if your community has a number of different populations that speak different languages if your mental health services are only offered in one language. So many of our programs we're looking at how to engage with communities of those community groups that were underrepresented and being underserved, and how to pull those communities into our services to help us in offering those services. Okay, and then provide state and local funds to adequately meet the needs of all children and adults, etc. Okay, and of course, it can't go without saying that we're trying to do all of this in the most cost-effective manner. And that's not because the money is the bottom line and that's what our priority is, but we know that by that being one of our priorities, that it then enables us to provide even more services if we're doing them in a cost-effective way. Okay, so 5 fundamental concepts inherent in the Mental Health Services Act. Community collaboration. We see that often and frequently, and it cannot be understated, the importance of collaboration. Cultural competence, client and family-driven mental health service systems, wellness focus, including the concepts of recovery and resiliency. So frequently in the adult system of care, we're talking about things from a recovery, in quotes, recovery perspective. And yet, if you're a child or you're a provider or you're a family member and you're receiving services through the children's system of care, the word that more often comes up and is used with regards to children is resiliency. And so sometimes there can be a disconnect if, as mental health boards and commissions, we're talking about our commitment to recovery, and because there may be a whole population of people who get services and work within children's system of care that are not used to that word, that tends to be a word that's associated more with the adult system of care. And so we want to be mindful that for some people, resiliency is actually the word, because for many people, they have, for children, they may not have experienced the long-term chronic impact of mental health illness on their lives. And so we're looking at building resiliency, so that ability to bounce back after maybe first episodes, or if there's an occurrence of a mental health issue that happens. And frankly, one of the things we can learn from thinking about how our different systems perceive this strengths-based, client-driven, kind of wellness-focused notion that people can function well with mental illness is the fact that we can consider, aren't adults also resilient, right? And so how would that change how we think about things and how we work with people and how we ask for services for ourselves and for our families if we think about the fact that adults also have that resiliency ability. And then finally, the fifth concept really inherent in Mental Health Services Act is that ability of that notion of making sure that services are integrated. Because if they're not, and people are getting siloed services, so to speak, then they may get lost, or they may not necessarily be able to access all of those services by having to leave one sort of system of care. And we could use medical care and mental health services as a great example, right? So if we're thinking about medical services or even educational services, for children, education is primary. And yet, if we're providing mental health services and we're not thinking about their experiences in the school, how much are we missing an opportunity to really support children and families? So paying attention to integrated services experiences for clients and families is critical. And then PEI, prevention and early intervention, taught us that we needed to start looking at outcome-based program design. So really being mindful of that. Okay, I'm going to pause here before we go on to the actual roles and responsibilities and see if there are questions. Okay, I'm not seeing any questions, and I'm not seeing any hands raised. So that tells me that we're ready to continue moving on. Okay, so roles and responsibilities. So again, we mentioned before that the California codes in the Welfare and Institutions Code section 5650 to 5667, we see that the Board of Supervisors, this is where the Board of Supervisors acting jointly shall adopt and submit to the Mental Health Director or to the Director of Mental Health a proposed annual county mental health services performance contract for mental health services in the county. And so what that means is that's, basically the plan for offering services and for meeting community needs in a county. And so as mental health boards who are appointed by the Board of Supervisors, we're in a position to inform that proposed annual county mental health services contract. Our local mental health board, specifically our purpose, our power, and our authority, according to that Welfare and Institutions Code, that we are enabled to, and we not just enabled, but we shall do the following duties. We shall review and evaluate the community's mental health needs and the services, facilities, and special problems. Now, does that mean every service and facility and special problem? Probably not, right? You're going to develop, if you're doing annual meetings, you're probably meeting monthly or bi-monthly, but once a year, most mental health boards and commissions stop, and they actually have a retreat or a special meeting where they think about what is our plan for this next year? What are we going to prioritize? So there's not the notion that you're going to be evaluating every single thing that is happening in your mental health system at a given time. But rather, you're going to pick and you're going to parcel out things that seem most important to your community's mental health needs. So, 1, review and evaluate your community's mental health needs, the services, the facilities, and the special problems. You're going to review any county agreements entered into pursuant to the Welfare and Institutions Code section. So that's referring to that plan for offering services. It may include certain programs. It may include who the providers are that are going to be providing those new programs if you have certain plans that have been approved by your Board of Supervisors. However, you'll do that in concert in most cases with your mental health director. Again, you're not going to be reviewing every contract the county has with every provider, but you may be looking at, and you will be generally aware of what the overall plan is. And most counties will have a particular committee. Some counties have budget committees where they're looking at these issues of how they're expending their money. And so by serving in concert with those committees as a mental health board member, you may have one of your members whose role, and maybe, and ideally it's in line with what their passion is, they may love doing that kind of oversight, you know, being the person that looks through all of those plans for services. Other people may rather be out in the community helping to evaluate what the community needs are. But so suffice it to say that, again, you're setting reasonable goals for yourself in the course of a year. 3, you're going to also advise your governing body. And who is that? That's your Board of Supervisors in most cases. In some of the cities, like City of Berkeley and Tri-Cities, for instance, where you're not a county per se, you will likely have another governing body that has appointed you. And so you will be advising them. And you'll be advising your local mental health director to any aspect of the program. And again, I stress advise. And advise doesn't mean that you can mandate, but it definitely can be done in a way in which you can make the need known about what your mental health board or commission is seeing in your community and why it is you feel that there's a certain recommendation about how to better meet that need, or how to continue meeting the need in a certain way if there are some successes going on. Okay, 4, also review and approve the procedures used to ensure citizen and professional involvement at all stages of the planning process. So what we mean by that is that here's the place where when you're asked to join the mental health board as a particular constituent, maybe you're representing family members, maybe you're representing consumers, maybe you're a community at large person. And also maybe you've been recruited because in your community there may be a high ethnic or cultural population, right? And so you may have been recruited to be able to help that community have voice on the local mental health board or commission. So you're really in a position with regards to this role and duty to really maximize your impact at saying how can the mental health system in our county improve the ability for citizens and for all professionals who are committed to meeting the serious mental health needs in our community and also prevention needs in our community. How can we ensure that they're able to be involved in our planning process? How can we make sure that they get a vote about what's important to them? And so you can do that in a variety of ways that we'll come to a little bit later in the presentation. And then finally, the 5th one is on submitting an annual report to your governing body, again, to your Board of Supervisors, on what it is you've seen in the course of your duty over that year. So what you've seen on the needs of people in your community and the performance of the county's mental health system. And in the next webinar that we do, actually, on I believe it's on March 7th, we will be actually reviewing how to write an annual report. Okay, so we're also, whoops, let me just back up and make sure wanted to make sure I wasn't advancing too quickly through these. You're also, as a local mental health board and commission, doing the following 3. You're reviewing and making recommendations on who's on the applicants for appointment of the local mental health director position. And what that means is that oftentimes your Board of Supervisors may have a committee that is formed within their body and that some of you may serve on in order to give input about who is being looked at in terms of the next mental health director if your position for your director is in transition, okay? And if you're not being engaged, you can also feel empowered by virtue of this particular statutory duty to insert yourself and ask to be involved in that process. It doesn't mean that the Board of Supervisors can't make their independent decision, but by being at the table, you can influence the types of things that you think are going to be most important for an applicant to have to bring to the table as a director. And 7, you're going to, again, going back to that reviewing and commenting on the county's performance outcome data. And what that is there's reporting on how well is our county doing. If we're having XYZ services, what does the data show? When we're doing surveys, how are we faring in terms of meeting the needs of different community groups and who's getting served, right? And so we need to communicate those things to the Mental Health Planning Council. And so that's an independent effort that's done, and CIMH often will conduct what's called data workshops for local mental health boards to help you with that. So in other words, we would come out and we would support you in looking at data that's been collected about your county and thinking through the process of, you know, what does this data mean and how can we use it in our roles? And then finally, especially in these days and times of more and more services being what's called realigned, which means when the services that you're responsible for. And this is a topic that we could have a whole webinar on in and of itself. But suffice it to say that if realignment is something that after we're doing this quick review of what does realignment even mean, that you want a little bit more information on, this would be a great topic for you to ask for your mental health director to speak to in your next meeting, maybe as a report out. And so what we see is that, again, under our purposes, powers, and authority, each year our program submits, or not our program, not our Mental Health Commission and Board, but rather our mental health system, our mental health services program prepares and submits plans that are updated annually and approved by your department after review and comment, or actually, let me reframe that and back up for a moment, because when this slide was created, it was actually implying that they're approved by the department, meaning the big department, Department of Mental Health, after comment and review by the Oversight and Accountability Commission. As I mentioned before, with the shift in the Department of Mental Health dissolving on a statewide level at the end of this fiscal year, this will no longer occur. There will be no approval by the Department of Mental Health, and there will be no comment by the Oversight and Accountability Commission on your plans. Your plans will be approved on your local level. And we do see, though, that as a local mental health board and commission, you're ensuring that there's a public hearing, though, on any draft plans and annual updates in your locality, so that the public, again, has the ability to comment, to question, to assert what their needs are, et cetera, before your local approving body, your Board of Supervisors, approves the final plan. Okay, so now I'm going to pause just for a brief moment and look over and see if there are any questions coming in, any hands raised. I'm not seeing any. And so I'm just making sure that you're all aware and able to ask questions. And this is part of my webinar etiquette, is that I want to be mindful about the fact that even though I'm doing the presentation and you're out there in the community, that we need to make sure that your needs are getting met along the way. Okay, so we're going to continue. And we're going to look at each of our individual duties now in a much more specific way and get kind of down to the nitty-gritty of it. So when we say review and evaluate, and this is the first of our duties that I alluded to already. We're looking at the mental health needs of the community, and we're looking at how, and so as part of reviewing the needs of the mental health community, first of all, how do we do that? We may informally or anecdotally know about the needs in our community. For instance, I might be an educator, and I might know what's going on in general in schools, and I have a picture, right? But how do we ensure that as a mental health board and commission, we are fully hearing from an entire community so that we're not relying on our representatives on our commission and board to speak for communities? How are we hearing from them directly? And frankly, this can be a really exciting part of being a mental health board member and commission member, is realizing that we know how to ask certain communities to participate. So we might hold a community forum. However, we may not ask them to come to our meetings. We may decide that if in our community there's a lot of issues going on in the schools, a lot of bullying, a lot of harassment, maybe there have been, unfortunately, some suicides. And this is not uncommon, unfortunately, as we know in our communities. And this is just an example looking at youth in schools. We may hold our community forum actually at a school. We may think, how can we partner with our schools to go where they are and be in an environment that's familiar to parents and educators and children going to schools? And how might that make it a better opportunity for us to get their community input? So that's just one example of how we might evaluate that. We also might conduct community surveys. Again, we would want to think about who is the community we're surveying. When I was doing some work on behalf of a county several years ago, and we were trying to evaluate what the mental health needs in that community were, there's a large migrant worker population in that community. And so we had come up with a survey, and we had someone translate that into Spanish. And then when we actually got some volunteers from that community to go to community markets or to farmers markets or to some convenings in that community and actually administer the survey. So we looked at how to reach the people who may have really unique ways of being reached either in the community or have their own ways of convening as a community. So again, thinking about how to get to the community and not necessarily always thinking about bringing the community to us, so to speak, in terms of bringing them to the mental health services system. Also, interviewing key stakeholders and informants. If there are certain communities that may have, or areas, even geographic areas of a county that may have certain people that are in positions to share more information about their community, we might invite in a presentation, or we may go out and conduct as an individual board member. I might go out and have a conversation with a key stakeholder in a community to find out more about what it is that community is experiencing and what their needs are. Also focus groups, right? Looking at community data. And this cannot go without saying, because in this day and age of having done so many stakeholder processes, there is a wealth of information about needs that's already been compiled in many of our stakeholder processes. And so looking at this last bullet and thinking about the needs assessments that have already been done, how can we get our hands on those, right? So that we're at least starting with a base of knowledge about what our county's already collected. Okay, and then when we're evaluating the public mental health services to ensure they're meeting the needs of the community, how do we do that? And so ways to review and evaluate the community's mental health services. So not now hearing from the community about their needs, but thinking about the services we're providing. How do we think it's going? Are the programs doing what we think that they're going to be doing? Are people finding value in them, et cetera? And this doesn't mean that if we're not finding success, that anything's necessarily happening wrong. So we're coming from a position of saying, in our ability to review and evaluate, and in the course of doing our duty to review and evaluate, we need to make it as non-threatening as possible so that people truly tell us what their experience is, right? And so we can frame that in terms of letting people know how we're going to use the information. We're going to use the information to make recommendations about how to further meet the needs of our community. And in that way, we say to people, you know, anything you tell us is going to be good, because what we're going to do with this information is we're going to have that allow us to shape how we make recommendations so that everybody is always being served in the best possible way. So the ways that we might look at reviewing and evaluating the community's mental health services are to have presentations, right? Many of your boards and commissions may have staff do report outs on different programs. Now, is that the same as going out and seeing for yourself the programs? No. No, it's not. But it's a very good way to get some basic information about programs and to hear how what the county does know about the ability of those programs to serve people. We also might have presentations by community groups. So if we have a PTA organization, to go back to the example of children in schools and that sort of thing, if we have some issues that are happening in schools and we have a PTA group or another parent group or a Healthy Start office on campus in our schools, we might go to them or invite them in to tell us what they're seeing in terms of our children's mental health needs within their capacity in schools. So it's a really exciting opportunity we have as commission members and boards to show that we really have an open door policy, and we're very willing to hear all of what's happening and how people's needs are either getting met or could use improvement in getting met out in the community. So we can also, second bullet says, participate on the county's mental health programs QI committee. And that's, and frankly, for the moment, I'm forgetting what the I stands for. But sometimes it's also called QA, Quality Assurance Committee, right? And those are committees which actually go through and look at some of the documentation that's created in our systems, progress notes, plans, client service plans, and that sort of thing. And those are committees that are already looking at how are we doing, how well are we doing at doing what we are doing, if you can follow that, right? And so that's another avenue for getting that information. Excuse me. You can also, if you're like me, I always like kind of going out there and being in the community. So some of us may, and we may talk as a commission and board at the beginning of the year or periodically about, hey, we haven't recently kind of seen how things are going with the mental health services. Maybe we need to schedule some site visits to some facilities and service programs, right? And so you'd want to do that in concert with your mental health director so that they can make sure that you have a way to do that in a way that's not going to disrupt services, et cetera. But so this is another way for you to review and evaluate if your public mental health services are actually meeting the needs of the community. So you may schedule to go out to a particular facility or to a service program and just do a site visit. You may arrange to have a program director or manager or head clinician or a family advocate or whomever may be best suited to support you and ask for there to be a walkthrough and for you to get a snapshot as to how are they offering services and what kinds of needs are they seeing in the community and how successful do they feel the program is. And what kinds of things might make improvements in their program. And hearing that from not just clients or family members or people, rather people to move away from a label kind of approach, not clients necessarily, but people who are needing to have needs met, right, by our services. It's also important to think about the information we can get from staff. And this doesn't mean that we're going into territory that we don't want to in terms of personnel issues. It's rather how are workers experiencing providing these services. And that can shed a lot of light on where improvements might need to happen or could happen, or what needs to continue, what's working well. The other thing, as we already mentioned, we can also review existing surveys and other data that's been collected. We can also survey people who receive services as well as people who are providing services. And it's really unique. We have a unique opportunity the more we're looking at the fact that many of our counties are now employing people who receive services within our system or family members whose families receive services within our system as employees, because those individuals have a really unique perspective as being both service recipients and in some cases providers. We're going to, again, review and evaluate county agreements, and I think we already talked about that sufficiently. So, whoops, let me go back up there. And I think that what I had on this slide, I was going to, excuse me?
Donna, this is Katie. I've had a couple people requesting a brief break, like 5 minutes to process information. So I just wanted to let you know because it's been about an hour and 15 minutes. So.
Okay. All right. So as Katie just mentioned, we're seeing that people could use a break. So it is now about 11:10. So why don't we take until 11:15 to take a break, okay? So I'm going to go ahead and put my phone on mute, and I invite you all to do whatever you need to do, and we'll check back in 5 minutes. Okay, and just as a reminder for folks out there who may have already gotten up and taken their break, we are taking a 5-minute break right now, and we have about another minute or two left. Okay, so I'm going to go ahead and ask right now, while we're waiting for folks to come back from their break, if there are any questions. And so go ahead and raise your hand if there are any questions, or go ahead and type in any questions you have. Any questions on the material so far, or any thoughts you're just having as we're going along here? And you need to raise your hand so that we can unmute you if you are wanting to speak. Okay. All right, so let's go ahead and get started again. And what I want to remind you is that this is a webinar that is intended to go until 12:30. We may end a little bit early, and we are about halfway through right now. So we're in good shape, and you're all being awesome. I like the way that you're asking questions. Some people have been using the little question box. So anything that you need, just continue to go ahead and use the raise my hand function, and that's in the attendee list. You'll see an ability to raise your hand. Okay, so let's go ahead and get started. Reviewing county agreements. And so we have already spoken about this when I did a quick brief review of all of the duties at once, and now we're going through them more methodically. But we did already talk about this quite a bit. This is a report which covers your mental health programs for your county. And in this case, I was going to try to put in a link to SAC counties to show you, but I was unable to add that link when I was preparing yesterday. But suffice it to say that if you are interested in your county's annual performance contract, that a great starting place would be speaking with your mental health director about becoming more informed in general about the performance contract, and asking that person to direct you, your board or commission, as to how to get more familiar with what that contract is, and how you can provide a little bit of oversight of it. Not oversight in an authoritative way, but oversight in terms of being able to be there in your capacity to review and evaluate, right? Okay, so we're going to move along. Again, advising the governing body. We spoke about this a little bit before. So you're in that capacity as local mental health boards and commissions to advise. And sometimes advice is welcomed, and sometimes advice is not welcomed. And sometimes advice and ability to receive advice is also mitigated by the, or not mitigated, but impacted by the climate in your local region or in your county, or by issues that are currently happening, right? So there are many things that are constantly going on in our communities. Our communities are very dynamic entities. And so our ability to jump in and provide our advice is one that can be done in a very deliberate way, so that we are looking at the way to allow people to be most receptive to the advice we want to give. And so we'll talk a little bit more about that later. But we see here that when we're thinking about how we provide that advice, it may be that we testify at Board of Supervisors meetings and workshops, or we're advocating with individual supervisors, right? And you want to be mindful of the Brown Act. The Brown Act says that you can't have a majority of your members meeting individually, or that actually constitutes a public meeting, in which case you'd need to notice people that you're having that. But that doesn't mean that as an individual member, you can't be talking to another individual member of a Board of Supervisors, right? And so you can be talking with them about that. One of the things that we'll touch on later, but it can never be said too much, I believe, is that while we all have individual opinions as mental health board members, to the degree that we're talking with people outside of our mental health board, as a mental health board member, we really want to be speaking with a unified voice. And we want to be making sure that we have an understanding as to who is speaking for the group in a public forum. And normally that would be your mental health board president. So you want to have that deliberate conversation as a mental health board or commission, so that you understand if we're all out in the community and we're talking with different people, we don't want to be undermining advocacy that we're doing on a group level by having individual conversations that may differ from what we're putting out publicly. That doesn't mean we sacrifice our individual thoughts. It simply means that we don't want to undermine our power in speaking collectively by having differing opinions out there publicly. We can also use our platform to advocate by providing written reports and advice within those reports, right? Our annual report is a good example, but we might also issue other memos or summaries of findings if we do a community forum that enable us to impart to others what it is we're seeing and what it is we're advising. And again, being mindful of we're speaking collectively as a mental health board. And reviewing and commenting on community planning processes and plans, that's really important. But our ability to advise our governing body really is one of the most critical responsibilities we have. And so it's going to be really important that we nurture those relationships we have with people we want to be able to influence. And that doesn't mean doing it in a way that is unethical or is untrue to the spirit of who we are and what we're trying to do, but rather it's a practical strategy for if you want to influence people, then you do develop good working relationships. And we're going to, again, want to ensure that citizen and professional involvement by holding public meetings and hearings, encouraging community input at board meetings. Now, I want to stop for a second and say that some boards, when I've gone and done individual board trainings, will look at things such as their public comment period. And they'll think about if that's one of the ways that we allow the community to provide input at our board meetings, then when do we want to have those public comment periods? And what do we want to have? How do we want those to occur? And so they'll really be deliberate in thinking about, do we want them only at the end? If we have a hot topic on our agenda, we know a lot of people want to be able to speak about it, how are we going to manage our time for that meeting? So they'll really do deliberate kinds of decision making, maybe about seemingly minor things, but if it's all geared towards allowing a maximization of community input, then as a mental health board or commission, you're going light years towards really creating a great relationship with your community if you're allowing them to have input in constructive ways and in purposeful ways at your meetings. Also, by participating as partners in your local mental health program and all aspects of community planning processes, you may be present during some of the planning process meetings. And so just because it's not something that's within your purview necessarily doesn't mean that you can't be seen as a partner with your local mental health department. Holding focus groups, we mentioned that before as well, and serving on health and human services committees, both internal and external. So again, if your county or your city or your constituency has different committees that happen outside of the mental health system but are related to the mental health services, and the needs of your community, then one of you may serve on one of those committees in order to gather more information and to hear from citizens and others about what their needs are. And again, we mentioned the annual report before, and that's another way of giving your advice and showing that you've done review and evaluation. But specifically, here are some bullets that talk about what we would put in an annual report. And again, this doesn't substitute for the webinar that we're going to do on March 7th, where we actually address looking at some annual reports and how they're actually created. But rather, this is a quick overview of the bullets and the types of things that are in your annual report and which you're required to provide to your Board of Supervisors. And that is stating simply your goals and objectives for the year. And that doesn't have to be anything fancy. You know, for many boards, one ongoing imperative that they have and priority that they have is making sure that they have adequate representation on their mental health board and commission, so that they're reflecting who their community really is. And it is not a wrong goal to have for your mental health board or commission, building your infrastructure, whether that's making sure you have adequate members, making sure you have diverse members, making sure that you have clear, you have people filling different executive positions on your board or commission, etc. Making sure you have youth representation on your board or commission. Those are all things that are worthy as being goals and objectives, so it doesn't have to be, but I would hope that it would also be that it would include some of those elements that are part of your statutory requirements, right, of reviewing and evaluating services. So, but your own infrastructure development and stability is important too, because without that, most boards feel that people become overtaxed in terms of responsibilities falling to a few rather than a collective whole. So in this annual reporting, you would be providing a description of your board's activities, any findings from the activities, and again, good, bad, indifferent, you know what I mean? The way that you frame annual reports can be done in such a way that you state things that need improvements in ways that are palatable, that don't blame people, but rather look ahead at what improvements need to be made, not what went wrong necessarily. Focus on the review and evaluation for the year. Your annual report may reflect that in the spring you did a certain function, you had certain priorities in the summer, in the autumn, in the winter, etc. You may highlight exemplary practices or services. So just as we mentioned that there can be recommendations for improvements, it is always a good idea to put in a report what is also working and successful. That's a very strategic thing to do in terms of keeping the positive momentum going in your county, whether that's within your services system or to the public who reads your report. Recommendations to improve and strengthen the mental health services program. Again, see the way that's framed. It's not about solving problems with the mental health services program, but rather recommendations to improve and strengthen. And goals and objectives for the coming year. Maybe you had a certain goal and objective that had been stated at the beginning of the year that didn't get met, and so you may reassert that that's going to be done in the following year. And again, just like I mentioned before, when we're talking about highlighting good things that are happening, including personal success stories, of course, with people's permission and in ways that protect personal information, to help them make the report more real or interesting or meaningful. Mental health director, again, can't go without saying that you are in an ability, you're in a position to review and make recommendations on any applicants that are being looked at for the appointment of the local director of mental health services or behavioral health. So what that means is if you are welcome to the table or invited to the table of the Board of Supervisors as they're doing this process, that's great. If you're not, it may not reflect them not wanting you to be there. They may not think about it. Frankly, you know, in this day and time of everybody doing so much so quickly and trying to keep keep on top of things, it's fine for your mental health board or commission to volunteer some folks. And so you would want to have your mental health board president or chair make contact with your board of supervisors representative to the commission or board, and request that involvement. The commission should also be included in the selection process prior. So in other words, ideally this is all happening well in advance of any appointment, so that you're not in a position of saying, well, what happened to us being included in that process? We had some valuable input about how to make that selection of the person. Whoops, let's go back. And commenting on the performance data, we already mentioned that as well, that periodically you will have access to performance data about how the services in your county are reaching people and what the outcomes are. And it's important to then communicate those along to the Mental Health Planning Council when the Planning Council requests that. And that has been on an annual basis, but that we're all going to just have to kind of sit tight and see how that plays out as we do the transfer of our county mental health services from Department of Mental Health to Department of Healthcare Services. And limitations, again, just a reminder that our Board of Supervisors can ask us to support them in other ways as well, but we cannot do that without them asking us to do so and giving us the authority. And then finally, the issue about realignment services, that because these are services that have gone from a traditional position of being provided from the state to service recipients and now are the responsibility of counties, that it's really important that in our purview of reviewing and evaluating services that we include those services that are now within the purview of the county and have been realigned to the county. Okay, I'm going to pause for a moment and just see if there are any questions. Any hands raised? And I don't see any. Okay, so we're going to continue. So practical need to know topics related to our roles and responsibilities. And some of this may go without saying, but let's see how well we can remember. Roles and responsibilities provide the foundation, right, for how our mental health board members and commission members identify their primary duties. And our primary duties are to what and what? That would be review and evaluate. Review and evaluate, okay, the effectiveness of services and to make recommendations. So we don't have the authority or duty to approve things. We can make recommendations, but our primary duty is to be the eyes and the ears of the public and looking at reviewing and evaluating what our community mental health needs are and how our services are able to be responsive to them. When we're reviewing county agreements, one of the things we can definitely think about is how are our state hospital bed contracts, or when people are 5150, where do they go? Does our county have the capacity to keep them in county on a 5150, or are we actually sending them out of county? So asking those types of questions, and then also looking at the performance outcome data. Working with our Board of Supervisors, key points. We mentioned it before, and I told you, and I hope you appreciated me saying it in that way before. It can never be overstated. Communication is most effective when the board speaks as one voice. There is no surer way to lose credibility and to lose the impact of a collective body than to have differing voices from that same body. Also, common courtesy is that notifying your mental health director, even though you're accountable to your Board of Supervisors and that's who you're charged to advise, there is nothing wrong with notifying the county mental health director before approaching your Board of Supervisors. It's common courtesy. And so your law also requires that your chairperson of the board or commission be in regular communication with the mental health director. So if you are going to the Board of Supervisors, it shouldn't be the first time you're talking to the mental health director. Also, when working with your mental health director in the department, collaborative approach, right? And I'm going to review these bullets quickly, and then I'm going to tell you why these bullets, I've put these in our presentation for today. So, you know, the collaborative approach can be used when satisfying your reporting requirements. It is not uncommon for your annual report to be reviewed by your mental health director or county staff. That does not mean that they need to change your viewpoints or what you're putting in your report as a mental health board or commission, but there can be multiple viewpoints held and documented as long as they have the right, and well, not as long as, but they will be strongest if they're accompanied by the rationale to support them. The law requires that the chairperson on the board be in communication with the mental health director, as we just said in the prior slide. So this is one document that it's not a bad idea to, when you've generated your annual report, and some boards and commissions do that in concert with the county staff, so they're already doing it collaboratively. But should there be a an issue, for instance, that arises, and so these points were developed after I was contacted by one particular county, and they said we really have differing opinions between our mental health department and our mental health director and our board or commission. And so what do we do in our annual report? What do we say? Who gets to have the final say as to how we report? And so that's where the second bullet came up. It's that multiple viewpoints can be held and put in your annual report. And sometimes that really shows the practical struggle that exists, or the diversity of opinion that happens in counties naturally and in communities naturally, because people have very differing needs and different ways of feeling that their needs will be met appropriately, okay? So it's not a negative to have differing viewpoints, but it will be strongest if each party can state what they're basing that viewpoint on. So for instance, community forums may give commission members or board members a reason to hold a certain viewpoint. And the mental health director, with their requirement to do budgetary oversight of a service system or of your services, they may have a different viewpoint on something. It's okay to have differing viewpoints, and we would just want to encourage you to support those in your annual reports with why you have those differing viewpoints. And maybe you would address if there's anything you're planning on doing about having those differing viewpoints, or if you just want to report on those. Individual board member key requirements. Some of the things that as a board member you're going to want to really be mindful of is your number one, your requirements in terms of your responsibility as a member to your other members, right, and to your obligation to be filling a certain role. If you were not in that mental health board member slot, someone else may be. So we want to always be mindful of really being conscious of that and to take our responsibility seriously. So that means ensuring that we have adequate attendance and consistent attendance, because without that we can't track with our fellow board members and commission members what's happening in a community. That we attend ethics training, that we're familiar with our laws, and some of that we're going over here today are the either roles and responsibilities, our statutory requirements, but there also might be other laws that are important for you to be aware of, or policies within your mental health department. We also want to make sure to constantly be willing to look internally, introspectively, at not only our own role as a mental health board member and how effective do we feel like we're being, you know, are there things that we think would make our own engagement as a member more meaningful to us, and in that way we would be impassioned to participate a little bit more actively, and as well collectively to think, how is our board or commission doing? If we had to do a self-evaluation of our board or commission, what might that look like? How do we know how people are satisfied with how we conduct our meetings? Are we conducting them in respectful ways? Are we having, could we use some help at some team building? Do we need to spend some time doing that kind of cohesion building as a board or commission so that we feel friendly and we feel like we enjoy our time together? And enjoy, you know, is a subjective term, but enjoy might be feeling that you are productively using your time and that you're being accountable to your community. So this is just an example, and this is from Sac County. So Sacramento County, thank you very much for having this available in your bylaws that I lifted this from, and I'm saying that facetiously. So for Sacramento County, for instance, they may have a certain policy where people need to attend a certain amount of meetings, and that there's and that it's clearly stated that what will happen if you're unable to attend that. And again, attendance is looked at as being, if you're not present, then how can you possibly be fulfilling your functions in reviewing and evaluating and representing community needs. So it's not a personal thing, rather it's a, are you able to professionally provide and fulfill your duties and roles and responsibilities. And when we're talking about compliance with mandatory ethics training, there's a website, let's see. Sorry, let me back up for a moment. Oh yeah, well, here we have it. It's right below. Sorry about that. So AB 1234 is the law which requires ethics training, and it requires that this training occur once every 2 years. There's this free online training course which meets this requirement if you're a board member or a commission member. And so you can simply go to this website and participate in getting that training need met this way. I would definitely encourage that if your county offers your ethics, and oftentimes counties will offer the training on the Brown Act and ethics training individually within your county. I mean, not individually to each member, but within your county it will offer it to your board or commission. And I really encourage you as much as is possible to do these trainings collectively, because there's a lot that can be gained in just having group dialogue about these issues. Awareness of the laws and the policies, as I mentioned before. We're looking at the Welfare and Institutions Code, right? The statutory section that gives us the authority to be operating as mental health boards and commissions. And in this statute, it states that we shall develop bylaws, and these will and require certain elements be included within these bylaws. And that's the number of members, and that will vary depending on the size of your county, of what you're required to have in terms of numbers. You can always have more, but I would definitely encourage, and I have been asked that by boards and commissions, of can you have more than that? And I would say yes, but be mindful of part of how your meetings are able to be held is by having a quorum present. So to the degree that you create unwieldy numbers of members that may or may not always attend, you may undermine your ability to actually have legal meetings. So boards and commissions can sometimes look for ways to add people to the activities of the board and commission through committees. And that's another way of having people involved from the community, but without actually expanding your number of members on your board or commission. And your board is required to reflect the composition of the demographics of your county, right? And as I mentioned, now we're on the third bullet here. A quorum, what is a quorum? A quorum is one person more than 1/2 of the appointed members. And the chairperson. We've said this before, but our statute also requires, that's where it's spelled out, the chairperson must be in consultation with the mental health director, recognizing that that is primary. And the board may establish that there be an executive committee, and sometimes that's helpful in terms of just having a certain core group of people who have a certain level of responsibility and can share some leadership responsibilities. Also being aware of your local board of supervisors policies and mental health policies in your county. bylaws, when we talk about our bylaws, I want to underscore that these are laws that are created and can be amended by your board and commission. So if you are not reviewing your bylaws, I encourage you as a board to do that. You could set up an ad hoc committee, for instance, and have a couple of members agree to just kind of run through them. See if there's anything outdated. See if there's anything that needs kind of updating and amending. But these are the ruling documents of your board. So, and it tells your board how to conduct business. What is important about bylaws is that you definitely be reviewing them, not necessarily changing them, but be reviewing them so that you're making sure that they're not outdated and asking your board to do business, for instance, in certain ways, or that you have certain requirements or certain committees listed that your board will be comprised of that are no longer reflective, perhaps, of what you're currently doing. Because they are set in stone, the third bullet here, it's in the interest of the board to keep them as brief as possible. They should set forth the basic structure and abilities of the board, but everything else, such as policy recommendations, should be somewhere else, not in your bylaws. And it's strongly recommended, as I mentioned before, that not only that you do a review, but that all board members be familiar with the bylaws. Because again, as a board member, this is where I understand what it means to be a member, what's being required of me in terms of attendance, etc. Okay, stretch breaks. So just like we took a 5-minute break a little while ago, I want to encourage us all to take a 2 or 3 minute break right now to reach up and stretch and just think, oh my goodness, I'm sitting here and I just need to stand up and not have Donna Matthews talking at me right now. And so we're going to take a 3-minute stretch break. So we'll have silence on the phone for the next 3 minutes, and I encourage you all to just stretch and reflect on what you've heard so far. Okay, we're going to get started again. So we're going to now talk about the third part of the third objective for our training today, and that's to think about strategies by which we can increase our effectiveness. And I like to think of it also as not just increasing our effectiveness, but increasing our own personal satisfaction. as mental health board members, being in service to our community, because frankly, we all bring a lot of passion to our roles oftentimes. We have personal reasons that have made us want to serve in this capacity. And there is nothing more important than harnessing that passion, harnessing that commitment in meaningful ways in our services as mental health board and commission members. So I encourage you that whether you're thinking about what committee you're active on within your board or commission, to think about and to share with your other fellow board members and commission members, what is your passion for being on the board or commission? What was the thing that motivated you to say, I want to serve? And then look for ways to apply that passion within your service on committees, within your service in reviewing and evaluating mental health services for your community. Okay, so let's get started. And the quote says down here at the bottom, it's easier to get there if you know where you're going. So it's easier to be effective if you think about ways that actually enable people to be effective. So effective boards attend to membership and recruitment, getting organized, getting work done, making meetings work, handling conflict constructively, active listening, positive advocacy, and again, that all-important self-evaluation by the board of itself. So again, we've mentioned, and a lot of this, while it may show up 2 and 3 times in our presentation, it's kind of set within different contexts, right? On one hand, we're obligated to be adhering to our bylaws and to be having a certain membership requirement. But equally, now we're thinking about by doing this, it's actually enabling us to be more effective. And so when we're talking about attendance and membership, we're talking about community mental health services it's specified within the Welfare and Institutions Code that a board shall have a membership of between 10 and 15 members that are appointed by your governing body. And that's, for example, Board of Supervisors, but in cities and in Tri-Cities, for instance, that may be a different body. In small counties, we see that there's an exception. So if we have less than 80,000 people in our county, we may actually have a board consisting of only 5 members, right? And 50% of our members need to be, let's just read it literally how the statute states it. 50% of members shall be consumers or the parents, spouses, siblings, or adult children of consumers who are receiving or have received mental health services. So this doesn't specify, for instance, that you need to be certain types of consumers or that you need to be certain types of parents. Rather, it simply states broadly that you shall be consumers or parents, spouses, etc., who are receiving or have received mental health services. It doesn't say public mental health services, does it? So there is nothing, and this is part of the beauty of the statute, while it's being very specific on one hand and saying a 50% membership requirement for these types of people, or with people who have this type of experience, it doesn't get constrictive. So it doesn't get constrictive in saying that these need to be consumers within the county mental health system, or that they're parents of people who have been consumers within the county mental health system, right? And when we think about parents, who are parents and spouses and siblings, we think oftentimes people will use I'm trying to think, so my apologies for brain lag here, but we think about the informal definition of parents and spouses and siblings. Because many of us have very non-traditional, or I don't even know if that's accurate, that term, non-traditional, because what may be traditional now is a family that has informal members that we considered, or people that normally hadn't been considered part of a family per se, weren't the mom, the dad, the mom, the dad, the mom, whoever, the aunt, the uncle, but rather they're the caregivers. And so for all intents and purposes, they are the family members. And so the statute is not constrictive. It's not really giving us a stranglehold by which to define who everybody really is, but rather it's giving us guidance. But it is saying that because it's so important that we have the voice of people who have mental health needs and the voice of people who are caregiving them or are family members, because that is so important, we do want 50% of our membership to be of those people. And so then there's a further breakdown to make sure that there's some equity within that breakdown of both consumers and parents or family members, so to speak. And that is saying that 20% of that 50% shall be people who have their own lived experience with mental health challenges, and 20% of total members shall be people who are family members of consumers or caregivers of people who are participating or maybe participating in services but have mental health needs that are challenging. And also the term of each member shall be 3 years, and terms will be staggered. Now, why is that? It probably goes without saying, right? If we think about the fact that if we all come in at one point, we all leave at one point, then there's nobody to welcome the new people and show them the ways that we've been doing things for consistency purposes. And that's important, not because we need things to be happening a certain way consistently, but because we're functioning as representatives of the community. And so we never want to have the community feel like there's suddenly an exodus of all people representing them and new people coming in and learning how to function as mental health board members and commission members. So we stagger our terms. We get organized. That's another key way of being effective. Is there's nothing worse than being part of a group and not knowing what direction we're going in, or how we can actually participate in a meaningful way in pursuit of our goals and in our roles as reviewing and evaluating. So what does that really mean? So first we want to get clear on who is it that we are. Let's update our rosters of mental health board members and committee lists. If we're not having that, if we're not having certain committees anymore because we've learned that we want to look at committees in a slightly different way. If we don't want to organize them according to children's services and adult services, maybe we're looking at them instead through prevention committees and other types of committees, then let's go ahead and update those formally, okay? And in that way, when we're speaking with people in the public, or we're representing ourselves with our Board of Supervisors, we can be speaking effectively about how we are organized. It also allows us to plug in ourselves, that passion that I spoke of that we all bring to the table. If we don't know what our current committees are that we have, then how am I going to know how I can best serve on my mental health board or commission? And so while this is actually, these tasks here in getting organized are traditionally the chairperson's role, under the chairperson's purview, if we think about the fact that each year a new person can be a chairperson, and if we think about supporting capacity of all members to be taking joint leadership, we really all want to be doing this together, and in that way we're being collectively supportive. And so we want to have an awareness of if all board member positions are filled, and if they're not, maybe we're going to create a committee on recruitment and membership and support, and then we're going to also be talking as a board or commission about how we fill those unfilled positions and who we need to engage with, especially if we're wanting to be mindful of our obligation to reflect the composition of our county. We're going to understand and comply with Robert's Rules of Order and the Brown Act. If we need to have guide sheets, one-page guide sheets for new members, maybe that's something that we can look at so that we all kind of stay on track with how to effectively participate in our own meetings and comply with these Robert's Rules of Order, for instance. We're going to oversee and participate in the preparation of agendas and calendars. that frequently committees will have their agendas set either by their executive committee or sometimes by their chairperson. Sometimes county staff will set agendas. But what these need to be are agendas that are reflective of what the board or commission wants to achieve, not what county staff want to achieve. County staff can be invited and welcomed to present on things that they think are important, and that would be very important to attend to, is to be listening to what does staff or the mental health director think is really important for the board to discuss at certain meetings. There may be very political or strategic reasons for doing things that may be off of the radar screen of the board and commission. And so there's that encouragement to work with your department to make sure that what they know is also shared with you, so that you're most effective in, again, your role to review and evaluate the overall effectiveness of your system to respond to your community needs. So let's see. So another way that people oversee and participate in the preparation of agendas is there's an email that's sent out just asking for people to send in information about what they want to have on, if there are issues of importance. Now you want to be mindful that email does not become any kind of a medium for discussing issues, because that would be that could be construed as a violation of the Brown Act, right? Because you need to be always deliberating and discussing openly. But in terms of the creation of an agenda, that's, you know, that kind of communication is acceptable. So the chair also wants to, in being organized, establish an executive committee so that it's not just one person interfacing with the mental health director, but rather have a couple of folks who are focusing in certain ways, in certain capacities, on your mental health board or commission that can participate in the preparation not just of agendas, but working with your mental health director. And identifying a secretary for the board. Some folks, some boards and commissions actually have a board or commission member who functions as a secretary. Other people may have a staff liaison that tracks and records minutes about what is accomplished in convenings of the board. Okay? And again, developing board goals and objectives in getting organized. Really important. And really important equally is that they be done in ways that do not overwhelm your board and commission or seem that they're irrelevant to your board or commission's focus and passion and awareness of community needs, right? So allowing your board to focus, by setting goals and objectives, you allow your board, you concretely and formally say you are asking your board what it wants to accomplish, and then you're documenting that as a goal and as an objective. It helps to set the annual expectations for all board members and for the public to know what to expect of your board. What is your board going to be doing this year? And it translates into an actual annual work plan. And in that way, if for instance, one of your goals is to increase your community outreach, then maybe part of your work plan is actually just mocking up, you know, a flip chart and having on that flip chart a different month of the year. And in each month, you start to plot out where will we hold our meetings if we want to increase our community outreach. And so in developing concretely a work plan, you start to set in motion right at the beginning of the year how you might be able to achieve those goals. And then at the end of the year, when you're needing to do an annual report, you're going to have a nice work plan to be able to reflect back on, to be able to then report back in a formal report, annual report, what your goals were and how you went about doing them, and then what the outcomes were. And a work plan, again, primary tool to anticipate things that might come up and to track stuff, right? If there's a certain objective that a committee has to, for instance, be assessing the environment at schools to see if kids feel like they have if there was a bullying issue, for instance, if a committee is looking at issues such as that, there might be certain things that they're going to need to have in place, you know, and that they may want to be working with their mental health director or county staff around. Maybe contacting schools, the local school board, you know, different things like that. And so having a concrete work plan gives everybody a snapshot as to what do we think we're going to be doing, how do we think we're going to be doing it, and then checking it in periodically along the way to say, were we able to accomplish that, or do we need to come up with a plan B, right? So that way, at the end of the year, you're not left feeling like, well, we ran into a challenge at one point and then we just stopped. So always staying on track. Agendas for your meetings should align with your roles and responsibilities, right? So frequently, board members, or not frequently, but I've heard enough that some board members sometimes hear about issues with people who are getting services and who are either have frustrations or lack of ability, and because you're from a community, you hear about people's difficulties, right? And so that does not necessarily mean that that should be the next item on your agenda as a board, that your role and responsibilities tell you that you review and evaluate services. When it comes to individuals and confidentiality in terms of people getting their service needs met, it wouldn't necessarily be appropriate to have a family or a person getting services come before a board meeting and discuss personal issues. Rather, it may be within the, that the board or commission member has a certain process by which they contact the mental health director so that that family or person's concerns can get addressed from within the system so that confidentiality is not breached, right? So in that way, we always want to be mindful that our agendas for our meetings align with what we're able to do. And the board work plan, along with our goals, as I mentioned before, provide that benchmark for doing an annual evaluation as to what did we want to do and how did we do. And then getting organized also, just making sure that we're aware of existing county policies and procedures and understanding and complying with our own bylaws. And a few minutes ago, I mentioned committees. So when we as individuals, and I'm including myself here because while I'm not currently a member of a board, I have been in the past. And one of the things that is really important is to immediately have a way to plug in with those things that you're passionate about and the commitment that you bring to improving mental health services in your community. So when we look at our committees, and this also goes towards ways to engage other people who may not be on our board, but want to be involved in the work of the board or commission. So using committees permits us to serve according to our strengths, right? Not just my passion, but maybe I'm an excellent person at developing surveys. So if we want to do an assessment of community needs, maybe that's the committee, the Assessing Community Needs Committee that I'm going to be on, because I really have a passion for doing that kind of stuff. Similarly, it also may be that we choose and we have people on our board or commission serve on committees that they want to learn more about. They may not necessarily come to the table with all of the background about how the budget committee works, but they know that that will really enable them to be more effective if they get more in tune with that aspect of how the mental health system works. So that when we're thinking about how people work on committees or through committees, we may also look at, it may just be that this is an area that I know I want to strengthen so that I'm a more effective board or commission member. And then within committees, there are a couple of different types. One might be a long-lasting committee that we know, we can kind of sense that we're probably always going to want to have that committee around. We can go ahead and put it in even in our bylaws, that we want to always have a membership committee, because that's always going to be an important thing. That we might always want to have a data committee or a budget committee or a community needs assessment committee or what have you, right? So these are committees that we envision being long-lasting. as opposed to ad hoc committees, which might be time limited and formed to accomplish a specific task. And so this actually might be a community assessment committee as well. All depends on how long you think you're going to want that committee around and how much that plays into your current and your historical goals for your commission and board. So the other thing I want to mention about committees is that your committees, and you usually state this in your bylaws, is that your committees are chaired by a member of your commission or board, and this is by design because you don't want to, you want to, number one, be able to have someone just like the Board of Supervisors representative from your appointing body as a board or commission, from your Board of Supervisors. Every mental health board or commission has a representative from their Board of Supervisors who has a seat on their mental health board. And that's by design in order to be that conduit of information back to the appointing body. But it's also to assure that that committee is operating in a way that conforms with the fact that it falls under the purview of your mental health board or commission. And so you want your chairs of those standing and ad hoc committees to actually be board and commission members. Other folks can be committee members. People from the public can be on your committees. And that's a really good way of using and utilizing people's expertise. When we think about the fact that employees within counties can, traditionally do not serve. They do not serve as commission members or board members. However, they can certainly be on committees. And in that way, we can really benefit from their knowledge and expertise. And so when I go to a committee or when I go to a county, and Sacramento County is being used as the example in case you hadn't noticed for this presentation, and that's because I actually reside within Sacramento County, so I went ahead and I used what would be, you know, an accurate sample for me to be able to speak from a personal perspective. So if I were thinking, what are the current committees of the Sacramento County Mental Health Board? I'm joining that committee. What would they be? What would be the standing committees? Which are their ad hoc committees? How might I plug in if I were a mental health board member there? And what is the function of them? Do they meet every month? Are they meeting bi-monthly? Who's the chair of each of those committees right now? And so, for example, some people have executive committees, membership committees, children's committees. And now we're going to go on to making meetings work. So we've talked about, excuse me?
Donna, it's Katie. There are 2 questions people have asked about committees.
Okay, so let's stop for a moment and let's go back to committees for a minute. And thanks, Katie.
No problem. Can you see them under your questions?
Yeah.
Okay.
So I'm seeing that we have one question is, do all committee activities have to conform to the Brown Act provisions? And let me think about that for a moment. The Brown Act pertains to how your board and committee function, or commission function. And so the Brown Act is looking at when there's a majority of your commission members and board members who are convening, right? And making sure that all of your decisions are being made in a public way. Your committees, you know what, Judith is asking this question. I'm going to do a little bit of research on this. In general, I would say that your committee members or your committee activities should conform to the Brown Act so that from a philosophical point of view, you're adhering to that notion of being transparent to the public, right? But your committee meetings are not actually normally making decisions. They are making recommendations, and the decision-making ability and the deliberation abilities of your board and commission is what needs to be transparent and conform to the Brown Act. So typically we'll see boards and commissions will publicize and put notice out for when they're having their board and commission meetings. Now normally committee meetings, it will be announced when those are meeting, but I do not believe that those have to conform to the Brown Act. But I will make a note about that, and I will actually, when I'm sending out the PowerPoint to all attendees, I'm going to go ahead and follow up and give you the information regarding the final say on that. And so the question is, Brown Act, does that apply to committees? So again, for the moment, while the committees fall under the purview of the board and commission, because they are not a decision-making body and they are not deliberating about how they're reviewing and evaluating, your committees, and think again about the fact that your committee is chaired by a board or commission member. So typically you'll have report outs at your public meetings of your board and commission, and it's at that time that discussion needs to be transparent and available to the public. So let's see, what is the second question now? Let's see. Any ideas how to increase board member attendance? Oh, that's a good one, Christopher. And when we're talking about how to increase board attendance, there are a couple of things. One is a pragmatic consideration I would encourage you to think about. So if suddenly we have a lot of people who are attending, if traditionally our meetings meet in the middle of a workday, and our membership composition changes so that many of our members are meeting or are working during a traditional workday, we may need to think about changing our time, right? So the answer would be twofold. Twofold means that, or actually threefold. One, we'd want to see if there are any pragmatic reasons why people are not attending. Is there a scheduling conflict that just keeps happening, in which case we might want to think about, is there a way to reschedule when we have our meetings? Two, are people able to participate meaningfully, meaning that I feel like my time is valuable, and when I go to my mental health board or commission meetings, I feel like I'm able to get be appreciated and have a place to share my knowledge and my expertise that I bring to the table. So if we're noticing that people are not attending on a regular basis, there may be a way that either the chair or maybe there's a membership committee, maybe the membership chair checks in with people and just informally says, hey, you know, how are you feeling? Or that might be part of your self-evaluation that you do collectively, right? That you may actually take time in maybe one of your closed sessions or what have you to do an assessment of how valuable do we feel like our time, how are we spending our time in a most valuable way? Are there ways that we could improve how we're spending our time so that we all feel like we're getting the most mileage for our time commitment? So those are considerations that I want to encourage. The other thing that I would encourage is that in terms of attendance, I would be very clear when recruitment's happening about what is the expectation. So it is not uncommon for people to want to serve on a board because they want to have a certain level of experience in decision-making in their local region. And that's not necessarily a bad thing, but we want to be clear about what our expectations are. And so being very clear and adhering to our policies or our bylaws so that if we have a certain requirement and somebody doesn't meet it, that we actually follow through with the consequence per our bylaws. It's going to be really important to do that. So, and in that way, we can kind of flush out where are the people that are able to make the commitment and actually follow through on it, and who are the people that are unable to. And it doesn't mean that we kick people off of our boards or commissions, certainly not. Oftentimes people really have a passion and a commitment ideologically to serving, but we want to enable them to serve in a meaningful way, and we don't want them to feel obligated to attend meetings when they have conflicting schedules, for instance. So we may invite people who are unable to attend regularly to instead serve via a committee. And in that way, we allow people to participate in ways that they're able to do successfully. Let's see if there are any other questions right now. Okay, so I see another question, and it's regarding the Brown Act. So I have a question that what if three members want to work on a specific thing like publicity? So again, I will do a little bit of research behind the scenes. I'm sorry, when you hear me pause, it's because I'm scanning through some of the other questions that are coming in. And I'm seeing that some folks are getting counsel, have some information from counsel stating that standing committees are subject to the Brown Act while ad hoc committees are not. And so, you know what makes the most sense to me in terms of respecting your time on the webinar and our time together is to let you know that I will do a little bit of research into that. And I will let you all know via email about what the outcome is and what I've been able to discern. And let's see, then there's one more question about can the board use teleconferencing and or go-to-meeting programs on the internet to increase member attendance? And this was an issue that I addressed several years ago, or a couple of years ago rather, with one board. And because of the requirement that your meetings be held publicly, you would need to then make arrangements for the public to also participate in those ways. So if you're able to do so, then you would be able to conduct those meetings that way. But if you're not able to do so, then you would not be able to conduct those meetings that way because those would not be considered public meetings. Okay, and now I'm just going to move along. Katie, do you see any other questions that are coming in right now? Okay.
There's one about using teleconferencing and go-to-meeting programs on the internet.
Right, and that's the one I just addressed, so I responded
to
that, so I think we're okay.
You're good then.
Okay. And so this is, again, an example of our process being very transparent to you all out there, that we're wanting to be mindful of answering your questions as we go. And folks who know me know I'm not shy in saying, you know what, I'm not positive about that, let me get back to you. So meetings, again, most effective when they meet their objective. And what is your objective when you're having your meetings? Is it to make a decision, generate ideas, get information? When you're using your time efficiently, like on our call today, on our webinar today, right? We're wanting to use our time efficiently. So thinking about your agenda and factoring in all the different things that are important to have happen during your meeting, and successfully managing your time. And most importantly, making participants feel satisfied, whether that's the public or yourselves, that a sensible, fair process has occurred. Staying on topic, not allowing people to dominate. Watching body language and taking breaks. As we saw this morning, it was great. You know, people were voicing, hey, excuse me, I need a break. And so we took a break, right? Because if we're not paying attention to what each of us needs, then we're not going to be most effective. And so when we're thinking about conducting meetings, oftentimes boards and commissions will use Robert's Rules of Order as a common basis for how they run their meetings. And I'm providing you with a website because this is a website I found to be very helpful in seeing in a user-friendly way a synopsis of what are Robert's Rules. So, you know, part one, and I'm showing you literally what this website shows, why having the rules. So you're going to a meeting, so what do you need to know? When you're looking at voting in elections, your bylaws and other rules, beyond the basics, and so you've been elected, right? And so in this way, again, this webinar is not a webinar on going through the extensive process of all of Robert's rules. Rather, I'm giving you a resource for yourself. And then being familiar with organizational acronyms. When we're talking, when I mentioned before the BOS, that's the Board of Supervisors, right? And so when we're conducting our meetings and we're trying to be effective, sometimes we use shorthand versions of talking about things. And so AAA, for instance, at the top of this list, no, it's not about our car, but if we use AAA in one of our board or commission meetings, and we mean the area agency on aging, it's, but the public might think we're talking about, car services. So being really cognizant of explaining what it is we're talking about when we're talking, in case we're using acronyms. And also helping the board to help community members, helping each other to help our community to understand other types of lingo, right? We're talking about processes for making decisions and stuff, or even just where we fall within that statewide structure that we started this whole webinar with. That's all part of the mental health lingo and systems lingo. And so a lot of times it can be really helpful for our community members just to get a little bit more of a lay of the land when we're talking about things. And handling conflict constructively. So when we're thinking about the fact that hot button issues sometimes come up when we're talking about mental health needs, we have limited funding, et cetera, et cetera. So looking at ways to, not just for ourselves, but to work, collectively as a mental health board and commission, think about ourselves as a team. So let's pick our battles. There is not going to be everything we can challenge. And so let's prioritize what's going to be the most important thing for us. And making sure we're developing good relationships along the way, so that when we do need to talk about difficult issues, or we do want to move forward on decision making, or influence our Board of Supervisors, that we've got great relationships in place that are going to support that being a smooth kind of process. And keeping people and problems separate, right? Listening first, talking second, setting out the facts, and saying we're committed to finding solutions. And sometimes it's as simple as using those I statements, that instead of blaming people, taking responsibility for simply saying where we're at. So I feel upset when, we feel like certain communities' needs aren't being met, rather than we never address certain communities' needs, right? Instead of it being a blaming thing, we instead talk about it as an I statement, so that it ends up setting a tone for us moving forward towards a productive solution, rather than putting people in an adversarial kinds of feelings. And this goes along with that, where we're talking about positive advocacy. So thinking about our roles primarily as mental health board and commission members as being advocates for strong and effective local mental health systems, and trying not to perpetuate what some people can, that there are some people or times when advocacy can be seen as negative when it is confrontational or blaming. And instead, encouraging there to be a positive perception of advocacy as being where we're looking to simply make sure that that we're using inclusive approaches to how to solve community mental health needs. And again, just several more tips and tools for positive advocacy, right? Doing our homework, developing the strategic partnerships, being clear about our message, knowing how and when to negotiate and compromise, and self-evaluation. So just as we review and evaluate the progress of the mental health system, we also want to make sure to assess the operation of our own board. And one of the things that will be sent out when we send out the PowerPoint will be a handout entitled "The Mental Health Board Evaluates Itself." And that's simply a checklist. It's a very practical checklist to go through and for you to consider in terms of how you do that self-evaluation. So, any questions or thoughts? Let's look and see if we have any questions. And I'm seeing people saying thank you for the presentation. Would I please explain what allowing the public to participate by video conference would look like? It means that whatever technology, if you are supporting your your board or commission meeting via teleconference, it means you would need to have that ability available to the public. So if you are doing a meeting via teleconference and you wanted to ensure that your public was able to participate in that same way, then your mental health board office might be open with a conference room, with a video conferencing ability hooked up to your meeting, and the public would be able to engage as well and to be observing your entire process. So that's literally what it would look like. So just think about it as being however it is your meeting, using technology or not, it means you would enable that to be available for your board and commission as well. Okay, so let's see. Our next webinar, since we're in a wrap-up mode now, we're at 12:30. Our next webinar is going to be on Wednesday, the 7th of March, Advanced Mental Health Board 101. And it's going to be looking at how to evaluate mental health programs. So looking at some of the tools that people actually use, evaluation forms that they use when they go and do site visits, and how to develop annual board reports. And there's a link there, and this web link and training flyer, the webinar flyer, will be sent with the PowerPoint to everybody who registered. And then next, lastly, we really value hearing back from you today by, as you close out of the webinar at the completion here, you're going to, as you close out, there will be an evaluation that pops up. It's just a couple of short questions for you to fill in to let us know in a couple of different ways how well you felt like you were able to understand the concepts of what we went over today and how easy it was to participate via webinar. So please, please do complete this pop-up webinar evaluation as you close out of the webinar. So again, I'm going to open it up and see if there are any final questions or anything. And let's see. I'm hearing thanks. I'm hearing thanks. You're very, very welcome. My contact information is on this last slide. So if you need to contact me, you can reach me via email at dmatthews@cimh.org. And I will be following up on those questions regarding the Brown Act and committees. So look for that in your email. And I thank you all for participating. So let's go ahead and I